Juggling resources is an everyday performance in hospitals. One of the most challenging tasks is securing a single bed room for a patient. Single occupancy rooms are a must-have. Without them, infected patients are positioned next to non-infected patients. This is a risk of spreading pathogens, which are becoming stronger and stronger. The World Health Organization described this as the endemic burden. The number of infected patients rise, they occupy more beds and congest wards, and even cause the cancellation of elective surgeries. Revenues are lost and the costs are skyrocketing. Why? What is the real issue?
And the issue revolves around the fact that we are using more and more antibiotics, and that because people are coming together in hospitals on these antibiotics, they are sharing the bugs that they have. They're sharing antibiotic resistance.
Things that we're particularly concerned about currently are things called gram-negative bacteria. The gram-negatives are much harder to treat because there are fewer antibiotics being developed.
Infections deliver a complex matrix to healthcare's doorstep.
One of the big drivers for outbreaks happening in the first place is failures in patient flow throughout the hospital. So you end up with, let's say, a patient who's colonised with MRSA in the same bay next door to a patient who's not colonised with MRSA.
Adult patients who develop hospital-acquired infection, HAI, remain in hospital 2.5 times longer than uninfected patients. The UK's National Audit Office noted that hospital infections were costing the NHS £1 billion a year. Annual financial losses are estimated at €7 billion. The annual bill of direct medical costs stemming from HAI for the US hospitals has been calculated at $45 billion. Hospitals and their managers must be flexible and respond swiftly to prevent infections.
There's no doubt that any paediatrician would just lust after a cubicle every so often because we're often left short of beds and short of cubicles.
The problem is that the fabric of hospitals, the very bricks and mortar, restrict what can be done.
The cost of this is incrementally huge in comparison to the pod.
So having more single rooms with the pod allows you to prevent transmission all the time, not just during outbreaks.
The biggest challenge in our critical care unit in patient flow was making sure that our patients were managed safely and effectively and not put at any risk from any infections. They're bifolding, so they open out to give us a normal open bed space, or can be closed because the patient does have infection.
Your chances of doing this and complying with hand hygiene protocols are significantly higher if you walk through a doorway compared with if you walk from bed space to bed space. The pods are designed to maximise the benefits of single rooms and open bays. They offer you the privacy and the containment of single rooms, but the visibility of open bays. So they have opaque lower panels to give you a sense of privacy, and transparent upper panels to give you visibility.
The airflow system is situated in the roof of the installation. You wouldn't even know it's there.
The pod has an air handling system that's designed to prevent the transmission of pathogens by air.
If we have had an infected patient, Bioquell actually come in and decontaminate it with, my colleague describes it as like a gas process.
Once a patient leaves a bed space, the area needs to be decontaminated. We can do this rapidly using the BQ50. It's small, fast and manoeuvrable, and we can get to that area and using one-touch operation with fully automated cycles, controlled wirelessly from outside the area, the pod can be cleaned within an hour.
Every bed space is a different size, every hospital has different nooks and crannies and corners.
For example, in the ICU setting, you have pendants dangling down with medical equipment on. The pod is custom built to accommodate those services.
The ability to manage patients within a safe environment is paramount.
To some of our patients that have been here for quite a while and they're more longer stay and just they don't sleep terribly well, so this is a perfect environment to have it a little bit quieter for them.